This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted you're with us today. And you know, we've been talking a lot about COVID-19, haven't we, Thomas?
For about 14 months we have, yes.
Yeah, but today we thought that we would actually go right to the front line and talk to a physician who's just been doing remarkable work at Parkland Hospital since the very start of this pandemic. We're delighted that we've got with us Dr. Nayak. He's a hospitalist at Parkland Health and Hospital System. Dr. Nayak, welcome to the show.
Thank you guys for having me, and I really appreciate your time.
You know, when you think in terms of patients, I know some really inspire you. Early in the pandemic, it's my understanding you had a special patient who became a source of inspiration for you. Can you tell us about him?
Yes, sir. This was the first week the COVID unit opened up. It was definitely a pretty scary time during that time. We didn't know much about COVID, and it was definitely very scary for our patients. So when we opened up that first week, I met this gentleman, Mr. Beecham. He was having obviously some trouble, and he had to be admitted to the hospital. But his focus and his motivation of getting out, was nothing to do with himself. It was about his wife. He was telling me, Doc, you got to get me back because I got to go help my wife. She's battling cancer right now. And their wedding anniversary and her birthday were coming up. It just so happens to be the same day. And he was like, Doc, I need to get back so I can take care of my wife and celebrate with her. And, once he got a little bit better, we were able to take some walks in the COVID unit. And luckily, I was able to get him home, and, I did whatever I could to make sure it was safe. We talked about, how to eat, how to go to the bathroom, where to sleep. I even had him drew out his house for me so we could kind of position them so they could, protect his wife from getting COVID. Luckily, he was able to go home, and on their wedding anniversary, they called me. And, being a hospital doctor, I usually just see patients at their worst when they need to be admitted to the hospital. And so this kind of one time I was able to see one of my patients at their worst and then now at their best. He called me just that day, and I wasn't even expecting. I gave him my cell phone number when I discharged him just to make sure, if he needed anything. And he called me that day, and he was just so elated and so happy that he was able to celebrate with his wife. And it brought tears to my eyes to hear that and just the gratitude for our team. And my wife was in the car, and, she's not in the medical field, and just to hear the appreciation we got, it meant the world to me. And he's helped me, throughout this time. He's always, we're always checking on each other, making sure we're okay. You don't get to meet people like that or that are just so selfless. And, he was battling COVID, but that wasn't what was affecting him. He needed to get back to his wife, and he needed to help her through what she was going through. And so I believe I was fortunate to meet him, and he's been an inspiration to me and helps me definitely on dark days. And he's just that bright light that I keep looking towards.
As we hear that experience early in the pandemic, if we fast forward to January of 2021, I heard you celebrated another event with him.
Yes, sir. Parkland was able to arrange that I was going to be the one that actually vaccinates him and his wife. I just kind of took a pause that day, and it's almost been a year at that time. And just to be, from the COVID unit, those dark times, to now being able to vaccinate them. And at that time, we didn't know anything, but now we have a vaccine that's pretty effective. And just to be able to help him even further and protect him. And, that was just a kind of one of those bright spots in my life that I was able to do that for him. And that was the first time I've seen him. We've talked on the phone and we've texted, but that was my first time to see him. And it's funny because, I was all gowned up in PPE at that time, and, he never saw my face. The first time he saw my face was actually on TV. And now to see him walking down the hospital lobby, and him walking so vibrantly, with his wife that I finally got to meet. That was one of the moments that I'll never forget. And being able to vaccinate them and make them even more safe now, it was just an incredible feeling.
What a success story. It really just makes you feel good to hear that. Sadly, though, many of the COVID stories are not success stories. For 14 months, you've been treating these patients. What are some of the highs and lows that you have personally experienced with COVID-19 patients?
And yeah, just last week, I had a patient. She had 5 family members that died from COVID, and unfortunately, she got to the point where she needed to be intubated, and talking to her and her husband, it was probably one of the lowest points for me, just seeing the sadness and sorrow, because for them, being intubated, they thought, that may be the last time that they were able to talk to each other, and definitely very difficult to have that conversation. But just to see the sadness and sorrow in his eyes, it really, hurt my heart. But, luckily our teams especially our critical care team, especially Dr. Kat Chen, she was able to transition to the breathing machine, and patients still holding, but still, it's definitely a low point for me when that happens. But, I was able to send people home that day too, and reunite them with their families. And just like, with Mr. Beecham and his wife, Janice, holding on to those positive moments, those bright spots, that's all I can do. And, it goes from one extreme to the other. And, there are some good days and there are some bad days. But, we got to clean the slate and start over and help somebody else the next day. And what I'm trying to do now is to go vaccinate. I think that's our best line of defense, also with masking and social distancing and hand hygiene. But that going and vaccinating other people and seeing them when they're happy, and it's such a positive moment in their lives to get vaccinated, and trying to be on the other side of it, that also inspires me and gets me going and reinvigorates me to keep going. But yeah, it's definitely a roller coaster, but I work with such a great team that they inspire me to keep going. And even at Fair Park today, when I was vaccinated, I met other doctors, nurses, teachers, firemen, police officers, just people in the community that are going out there and helping and just doing good things. And I just remember at the beginning of COVID, when that COVID unit, opened up, the community donated food, all the restaurants, Mark Cuban, they all donated food. There was a few people that donated iPads so people could talk to their families, to video chat with them. And I just saw the power of this community coming together and helping us help other people. And now, we're transitioning towards that. We have this vaccine that we're able to go and help. And I just encourage, all of you to, if you can, if you're clinical and non-clinical, to go volunteer. If you can't volunteer at Fair Park vaccinating, go volunteer at the food bank, or do something that brings you joy, and just try to help this community, because when we needed the help, you guys were there for us, and now we're returning the favor.
And what an incredible story this is. Dr. Sat Nayak, a hospitalist down at Parkland Health and Hospital System. We are going to continue this amazing story when we come back next on The Human Side of Healthcare. If you didn't catch all of this, it's on our podcast, wherever you get podcasts, The Human Side of Healthcare.
This is The Human Side of Healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back to the human side of healthcare. And you know what? We're now going to talk about the human side of COVID. What an incredible first segment. If by chance you missed it, please catch it on our podcast. We learned that COVID is not just a virus. COVID has a human side to it. How does it affect individuals? Unfortunately, people get sick. Some even die. This is touching the lives of all Americans. And even though many people know that we're moving as quickly as we can to herd immunity, the virus still has a human aspect. Now, we're going to focus on how that virus affects healthcare workers, not only in their professional life, but in their personal life.
We're continuing our conversation with Dr. Sat Nayak. He's a hospitalist at University of Texas Southwestern Medical Center and Parkland Hospital. And the segment you just heard has been on local television quite a bit. Steve?
At the height of the surge, say around the second or third week of January of the second large surge, what does it do to the morale of the workers in a hospital when you have to open another COVID unit?
Yeah, no, it's definitely devastating to first see the numbers go down and then back up. But I think at that point we're definitely better prepared, and so people are more resilient at that time. But there's definitely a dark cloud that kind of goes over, and you can see people aren't smiling as much. But I think what kind of pulls us together is just having such a strong team and strong leadership at Parkland and at UT Southwestern, and just feeling that someone has our back, and then having the community there supporting us so we don't feel alone. And although we definitely felt down, we had those people around us, that team, the community with us to help keep us going. And so although we dropped down, we were able to keep going and moving forward.
You mentioned vaccinations, and I know recently Johnson & Johnson had to pause their vaccine. And then, of course, there were a lot of people that became concerned, are vaccines safe? What should we do about Pfizer and Moderna? In your medical opinion, what do you think of the vaccines and the safety of the vaccines, and for people who have yet to be vaccinated?
All right, that's a great question. As you can see, with Pfizer and Moderna, they're well over 94% effective. And yeah, we thought that Johnson & Johnson, we're with just one vaccination would curb a lot of this hesitancy. And it's, I still think it's a good vaccine. Obviously, they're testing it further and looking into the issues that arose. But the Pfizer and Moderna, they've shown to be safe and effective, not only in testing but also in the population. And so I definitely encourage people that haven't already been vaccinated to go get vaccinated. This is the best line of defense we have at this point. And to protect yourself and your families from coming and seeing people like me at the hospital or even dying, that is our best line of defense. So I definitely encourage everyone to get vaccinated, and not only just to keep yourself safe and your family safe, but to kind of get us towards to back to normal life, whenever we're able to kind of achieve that herd immunity and, be able to not only just individually your family, but just the masses, and get to that point where they're not having to be hospitalized, that they're not dying. And so I definitely encourage people to get the vaccine.
As a physician treating COVID, when COVID first came to North Texas, there was no medical journal, there was no procedures on how to do this. And I always say many of the physicians had to fly the airplane and file the flight plan at the same time because this was a new virus. Can you explain to our listeners how over the last 14 months, the clinical community, not only in North Texas, but throughout the country and even the world, have shared best practices on how to treat COVID?
Exactly. That's what we did. We called, my friends, West Coast, East Coast, friends at Cornell, Harvard, Stanford, and we all just kind of pooled together all of our resources, not only at Southwestern and at Parkland. We kind of gathered all this information that was out there, and even not just domestically, internationally too. And we, looked at all the data and tried to gather as much information we could and made the best decision we could at that time. Obviously, as being in the medical field and in science, things do change. The more data you have, the better decision you can make. And so at that time, we did make those decisions, and we had to make some changes throughout that time. But it was all of us coming together and working together, sharing information, learning from each other. And that's what got us here today. And I think that's during, whenever kind of we have these tough times, when we come and work together as a team, that's how we get through this, and that's how we keep moving forward. And I definitely saw that at the beginning, and even to this day, we're all sharing information, working together, and trying to do the best we can for our patients.
You've brought up some excellent points, and you've talked about things we should and shouldn't do. As a frontline physician treating COVID patients, what is your message to our listeners if they have been vaccinated and they still go out into the community? Should they wear a mask?
Yes, definitely. Just this past week, 3 or 4 patients that either got the first vaccine or the second, but they didn't achieve full immunity yet, and they went out and they got COVID, and now they're in the hospital. And so I definitely encourage people that even if you got vaccinated or not, still wear your mask, practice social distancing, practice that hand hygiene. And if you do get vaccinated, you still have to wait until you become fully, immunized, and stay protected. And then if you are at that point, help somebody else get vaccinated. Go volunteer and help everyone else. And that's how we're going to get through this, is working together, working as a team. And that's the only way through this.
You've mentioned volunteering several times, and you work long shifts at Parkland, and yet you still find time to go volunteer to give vaccinations. How do you find the time?
Yeah, I think one thing is, I'm just tired of having those conversations, with the patients. And I feel like vaccinations are one way that we can prevent that from happening. And so as much as sadness and sorrow I see, going and giving the vaccinations and helping that reinvigorates me. The second thing is I know everyone's hurting, and you don't have to be in the medical field, but my wife, she's, starting a small business, and seeing her, wake up even before I wake up. And when I come home from the hospital, she's still working, and she's, starting from scratch, working on her business. It just inspires me that people, from all walks of life are fighting. And just to see her do all of those things, and it's just amazing for how hard she works and what she's able to do despite COVID, despite the lockdowns and her manufacturing getting shut down. She's still able to move forward, and that inspires me to keep going and always to keep fighting and always to keep moving forward.
As you talked about volunteering, to our listeners out there, if they are inspired by you and they want to volunteer, especially to administer vaccines, say at Fair Park, who should they contact?
Right. I'm pulling up the email right now. It's Alejandra.m.Hernandez@dallascounty.org. And it's ALEJANDRA.HERNANDEZ @dallascounty.org.
Well, hopefully you've inspired some of our listeners that will go there and volunteer. And as you said, even if you don't volunteer at a vaccine site, maybe help the North Texas Food Bank. Dr. Nayak, what an amazing story. Thank you for all you do. Thank you for being on the human side of healthcare.
No, and thank you guys for spreading the message and trying to get more volunteers, trying to get more people vaccinated. I do one side of it, but the way you guys educate people, and that's another battle in and of itself. And I really applaud you guys for doing this and spreading the word and making sure people get the right information.
That's Dr. Sat Nayak. He's a hospitalist down at Parkland Health and Hospital System. Incredible, Steve. Just incredible what we've just heard.
You're so right, Thomas. And I mean, that really does put a human side on this.
Hey, I want to ask you something, because we're going to segue into the next segment and this whole concept of herd immunity. I mean, number one, we're calling ourselves cattle. I mean, that's kind of a strange expression, but the concept is we got to do this together. Are we moving in the right direction? And what is herd immunity?
Here's the issue, Thomas. We've had many people slow down as far as getting the vaccinations. The demand has dropped off tremendously. And when that happens, if we thought we were going to achieve herd immunity, say in the middle of June, it now may be July or August.
Well, that is worth talking about, and we will next with Dr. John Carlo, Prism Health, North Texas, on the human side of healthcare.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
And welcome back to the human side of healthcare. And you know what, Thomas? We're going to talk about herd immunity this segment.
All right. So that means, like we just were talking about in the last segment, us all working together is basically what that is. And, you know, it's been interesting, Steve, because this gets into a statistical quagmire, really, of what is it and how do you get there?
You know, you're right about that, because you essentially take people that are vaccinated and then people that have been infected and try to achieve some magic percentage that says you're in herd immunity.
So in this segment, we're going to bring back somebody who is an expert on this, Dr. John Carlo. He's the president and CEO of Prism Health North Texas, and he's also on the Texas Medical Association's Vaccine Task Force. So he has a very prominent position in the state on this and a great perspective. And we're going to ask him some questions about how do we get there and what this is.
Dr. Carlo, I'm confused, and let me explain to you why. I just said people that are vaccinated plus the people that have been infected equals some magic number. What happens if those people that were infected develop antibodies, then after about 6 months lose them, they don't get vaccinated? Don't we lose herd immunity?
Absolutely, absolutely. I mean, and I think that's an important point and distinction. You know, we've been gravitating towards this herd immunity number as almost like the finish line. You know, that we've run the marathon, we see the finish line in front of us, and if we can just get to the 85 to 90% herd immunity, then we're all done and we're finished. And unfortunately, that's not how this is going to work. In addition to your point of individuals recovered antibodies, in other words, if they've had a coronavirus infection and have protection, that's not particularly long lasting. We don't know how long, but it will likely go down over time. You know, in a community, especially such as Dallas and North Texas, we're a very fluid community. In other words, people are moving in and out of our community constantly. You know, this changes the makeup of our herd immunity by just the very nature of who's coming in and who's leaving. So I think herd immunity is not a finish line. It's a goal, but it's really just the starting point. And it's a process of slowing down the transmission, not stopping it, unfortunately. And that's the key. This is sort of the epidemic curve. And, you know, we remember a year ago, we talked about flattening the curve, and we haven't, you know, really brought that up in a while. I guess we kind of got tired of flattening the curve, but it really is the same thing, that we're not ending the epidemic. We're trying to slow it down.
You know, that's a good point. And as you were talking, you know, I thought about what you said about movement and travel. Let's say that North Texas achieves herd immunity, but the state of Texas doesn't, and the United States doesn't. So even in your little part of the world, if you achieve herd immunity, would you say that our lifestyles still are going to have to be carefully looked at as far as wearing a mask and taking extra precautions because of the things I just said?
I think so. I think it's an unfortunate sort of consequence, because we know that coronavirus does what it does in terms of causing what we describe now as super spreader events. And, you know, keep in mind, these happened early on. It really likes that opportunity and can really explode in terms of the number of cases. You know, I mean, I think it's very easy to see that one case in a group of people could easily infect a lot of people at one time. And this is the remarkable thing that coronavirus does. So given that parameter, it's very likely to see what we talked about earlier with the measles situation, where you could have sort of almost little mini explosions or outbreaks in confined settings, or where the population has really reached that opportunity for a lot of coronavirus infections to happen at one time. So, you know, unfortunately, we can, very quickly foresee a lowering of the number of cases, which is really, of course, our overall goal. But as we start getting down to those smaller numbers, what I think we're going to find is in places where that microenvironment is low, the herd immunity is not good, you're going to see cases, really kind of explode in that micro environment, if you will. And so, we've got a long way to go. And I think it's back to the other point is why, we have to continue our social and physical distancing, for now and really for quite a bit more until we really get a sense that this is going, to a level where we can handle it.
Dr. Carlo, it's Thomas Miller here. There are a couple of types of people when it comes to this kind of thing. Some just want to know the basic information. Doctor, tell me what to do. And then others want to, they want to read the material. They want to do some research. Can you, in just a few minutes, tell us about messenger RNA for those in the second camp?
Sure. And, it's a technology first that's important to know that it's not new. I think there's been a lot of misinformation about whether this is a untested technology or something to that effect. And this is something that we've been using for quite a while. What is new, though, with these new RNA vaccines is this is the first time we're using it as a method for vaccination. But really, the mRNA technology is really just the mechanism that we're using to supply our bodies with that critical piece of information on what this virus looks like so that we can, create our antibodies and be ready in case we actually see the real thing. And so what the mRNA does is it actually allows for these tiny genetic sequences that, the fingerprint, if you will, of the virus. It allows that to enter into our immune system safely so that information can be processed and delivered so that we can get our cells and systems ready to defend ourselves against a natural infection. So really the mRNA is sort of just like the car or the vehicle that's getting us to that right place. And it's just one of several different technologies that are being used to do that exact same mechanism.
So just keeping it really simple for a radio program, in essence, it's showing our body what the virus behind what we call COVID-19 is and tells our body, if you see this, go get it and kill it. Is that pretty close?
That's pretty close. I mean, I think it's important to know it's actually the genetic material of the virus, so not even the virus itself. So it's really the fingerprint, if you will, of that virus.
So when we talk about this, how long the vaccination is going to last, what in that process is creating a lifespan where it might need to be renewed?
Well, that's a good question. I don't think we know the answer to that. It's coronaviruses in general, is one of those things that, keep in mind, we have natural coronaviruses that give us the common cold every year. And we know that just because you've had that coronavirus maybe a year ago doesn't give you the protection for this year's coronavirus. I don't think we've really looked at that to a degree to say why it is particular to the coronavirus that our sort of immune system response isn't as long lasting as perhaps other viruses or bacteria. I think some of it has to do with the fact that it's a respiratory virus, so that it's a little harder to protect yourself when you have viruses enter, through your nose and mouth, and having those immune system ready to sort of defend itself against those areas. But, this isn't a question I don't think we know the answer to at this point.
If, let's just presume, so they're looking at the potential of clots. If you were to reverse engineer this, and not that we're trying to understand the technology, we never will as lay people, but if you were reverse engineering and looking for clots, where would you go looking first?
Tough question. We're going to find that answer. I think at this point, and this could change on a moment's notice, so I don't, we don't want to say this is definitive, but one of the things we'd look at first is platelets function. We could make some judgment as to what's happening, because we do know that these clots situations have shown up with low platelet counts. So we want to look at what's happening to our platelets if in fact this is the connection. And so there's some things around that we do know from other conditions that kind of create the same effect. And so that's one of the things we're studying right now. One of those, it's very complicated, but there are some drugs or circumstances that have created very similar expressions. And so we're going to carefully look at that to see if there's any causation, as I mentioned before, that would give us direct evidence that there's something that we need to be concerned about.
And then the other cousin question to that is some people are experiencing side effects after particularly the second vaccination and the others. But we have seen stories of people with the J&J having side effects too. You had the AstraZeneca vaccination as a trial. Mm-hmm. What is it that's causing those side effects? Again, this process of telling your body to go find this genetic sequence. Why is that causing fever and chills and fatigue and basically symptoms of the virus itself for about a 24-hour period?
I think that we could make some educated guesses about that based on exactly what we've been talking about that this vaccine does and how it keeps our body safe for the actual infection in the future. So I think it does show to some degree that what's happening is the vaccine, is showing our body something that it's fighting off and making those antibodies. And in that process, we're probably getting some inflammation that would be normal as expected if we were fighting off any other type of infection.
Dr. John Carlo, Prism Health, North Texas, and the Texas Medical Association Vaccination Task Force. Thanks for all those great insights. Wanted to remind you of our podcast, too. It's The Human Side of Healthcare. Just go wherever you get your podcasts, and we are there, where we have been talking to and interviewing some of the top medical experts across the Metroplex for the past 14 months, covering COVID like a blanket. And speaking of that, when we come back, we're going to talk to one of the top infectious disease experts in the country, and she's right here in the Metroplex, Dr. Trish Perl. She's chief of the Division of Infectious Diseases at Parkland Health and Hospital System, and of course on the faculty at UT Southwestern Medical Center. The topic, childhood vaccinations. Boy, has this been on our minds. Dr. Trish Perl next on The Human Side of Healthcare.
Covering the healthcare topics that matter most to North Texas. This is The Human Side of Healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're going to be talking now with Dr. Trish Perl. She's chief of the Division of Infectious Diseases at Parkland Health and Hospital System and is on the faculty of UT Southwestern Medical Center.
You know what, Thomas, you're right. We've got one of the premier experts in the world. We're hearing a lot about vaccinations. It's going to be so refreshing to get a scientific approach as to why our kids need immunizations. She has the data to really explain to us why vaccines really have been the saving grace over the last 100 years to keep our kids safe from childhood diseases. Thank you for being with us today.
It's my pleasure. Thank you for having me.
You know, we hear a lot, we read a lot, and I think there's a lot of unknown related to the vaccination debate. Why is it important to provide in a timely manner vaccinations throughout a child's childhood?
You know, what people may not recognize is that there are two public health interventions that have been done more to enhance the world's health than anything. And one is the development of clean water, and the second is vaccination. It has been remarkable what we have been able to accomplish in terms of decreasing deaths and significant morbidity or complications from infectious diseases in really the past 100 years. And I think that recognition is really important in terms of how these have really impacted the quality of life and the length of life in the United States.
So for our listeners, especially the parents, but also family members, nieces, nephews, etc., what would you recommend for the children? What vaccinations should they receive?
So there's a standard group of vaccinations that are recommended for all children. And these are commonly offered by pediatricians. They're free. And they have been developed because these were the diseases that were most likely to either kill or harm harm them. And they include tetanus, pertussis, diphtheria, which is now called Tdap, measles, mumps, and rubella, or MMR. We currently give influenza vaccination to children over the age of 6 months. We are currently giving them hepatitis vaccines, which is very, very important. And we are finally giving them some other vaccines for bacterial diseases that include Haemophilus influenza. In some children, they'll be getting a pneumococcal vaccine if they have certain risks. And then in older children, they're offered additional vaccines, including meningococcal vaccine when they become teenagers, the HPV vaccine when they're in the 10, 11-ish range. So there are different vaccines. But what I would also say is 2 of these vaccines actually not only prevent infectious diseases, but they actually prevent cancer, which have been remarkable developments. So the hepatitis B vaccine as well as the HPV vaccine not only prevent infection, but cancer.
That's so important. And, we're talking about children. I am very blessed. I've got 3 wonderful grandchildren. But I remember when my first grandchild was born, I went and got shots before I saw. Can you elaborate a little bit on why grandparents for the first time should make sure they're up to date on shots?
There is something called a cocoon effect where we want to protect people who are vulnerable. So in this case, we're talking about young children. A lot of them will not be able to get vaccines until they'll start their vaccines usually when they're about 2 months old. There's some vaccines we can actually give earlier, but they will not be fully immunized and protected for a significant period of time. What we try and do in those particular cases is vaccinate those people around them to basically form a cocoon and protect the children from any of the infections that could potentially circulate. So one of the best examples might be the measles, mumps, and rubella vaccine. So you can't give that to a child, or we don't give it to a child, except in very unusual circumstances until they're around 15 months old. And in that case, if we can protect the grandparents and the parents, that then is a way of cocooning that child and protecting them from the infection. Same thing is true with pertussis, which is probably one of the vaccine that you were given. We as adults are we sort of get pertussis as a mild cold for us, but we lose our protection or our antibody to it after 3 years, and so then we could get it again. But because we have mild symptoms, we could inadvertently give it to a child, and very young children actually die from pertussis. It's a serious disease for them. So what we do is we vaccinate the grandparents. That's a long answer to try and explain the rationale behind vaccinating at all ages.
You did a great job, and you're exactly right. Those were the vaccinations that I did receive. I introduced this topic as the Great Vaccination Debate. As a layman, it seems to me there's reliable scientific information available. But why do so many people and parents still question vaccinations or vaccines? Do you have any thoughts on that?
There is really a lot of interesting, I will say, data out there. And it revolves around a lot of issues. But one is that people just don't know. They don't know the data behind vaccines and how important they are. We, as a medical community, that includes me, have not been able to translate this importance into simple words to help them understand how important it is. Second thing is that, as medical care has changed, we have not valued paying people to take the time to actually educate parents. It takes 30 minutes to go through all the pluses and minuses and whys and whatever of vaccines, yet we're not reimbursing physicians to do that kind of work, which is very, very important because people listen to their doctors more than anyone else. If your doctor says, I'm going to vaccinate your child, that is a huge clue to the parent that you think this is important. Third thing is there's a lot of misinformation out there, and I don't have any sort of magic wand to tell us how are we going to counteract the misinformation, but I think there's been a lot of damage done by people who say that vaccines are associated with autism. I mean, the data are just so strong that show that there is absolutely no association. And we haven't been able to counteract that effectively and just say that data is wrong and these vaccines are extremely safe. So I think there are a lot of reasons out there, but those are some of the primary things, and I think we just have to become more effective communicators. We have to value the communication, and we have to get the facts out there.
And Dr. Perl, you mentioned vaccinations for children are free. Where can people go to look for them?
There are a lot of ways that you can get vaccination. You can get vaccination, obviously, from your healthcare provider, from your pediatrician, from your nurse practitioner, from your PA, wherever you go to seek medical care. And I think people should understand that vaccines for children are free.
Dr. Trish Perl down at Parkland Health and Hospital System and UT Southwestern Medical Center. Steve?
Thank you for joining us today. We're going to see you right back here next week.